Hello viewers, today we'll look into the classification of diseases of the kidney, and after that we will look into the etiology, characteristic symptoms, dietary management in glomerulonephritis. But before we start, let us look into the basics of kidneys. Kidneys are bean-shaped structures, each about the size of the fist and weighs about 150 grams in the males and 135 grams in the females. They are typically 10 to 12 centimeters in length, 5 to 7 centimeters in width and 2 to 3 centimeters in thickness. In spite of being so small, they do tremendous job inside our body. Each kidney contains around 1 million units what are called nephrons, each of which is a microscopic filter for blood. It's possible to lose as much as 90% of kidney function without experiencing any symptoms or problems. If we look into the basic functions of kidneys, most important, they maintain body composition and balance the body's fluids. It regulates fluid volume, its osmolality, electrolyte concentration and pH by varying the excretion of water and ions in the urine. It also removes waste products from the body, could be urea, uric acid. These are the major end products of nitrogen containing compounds like proteins and purines, pyrimidines. It removes drugs, foreign substances like toxins from the body which are taken either intentionally or unintentionally by the body. It also releases a hormone renin which is produced by the juxtaglomerular apparatus, catalyzes formation of angiotensin that regulates blood pressure and salt balance. The proximal tubule cells produce an active form of vitamin D, 1,25 dihydroxycholecalciferol, that promotes strong, healthy bones by regulating both body calcium and phosphorus. It also controls the production of RBCs. Erythropoietin stimulates the maturation of RBCs in the bone marrow. The functional renal unit is the nephron. It is composed of the renal corpuscle, glomerulus and the Bowman's capsule. It has proximal convoluted tubule, very often abbreviated as PCT, which is located in the renal cortex. It has a descending loop of Henle. It has an ascending limb which resides in the renal medulla, leading to the thick ascending limb. It has a thick ascending limb. It has a distal convoluted tubule, very often abbreviated as DCT, and there is a collecting duct which opens in the renal papilla. The glomerulus is basically a tuft of small blood vessels called capillaries located within a Bowman's capsule within the kidneys. It receives blood from a single artery, what is called as the efferent artery. Contraction, relaxation of this artery can affect the pressure of the capillaries in the glomerulus and consequently helps in the filtration of blood. Capillaries of the glomerulus are lined by endothelial cells. These pores allow for the free filtration of fluids, plasma solutes and proteins, but they are not large enough that RBCs can be easily filtered. Now this is the basic functioning of the kidney, and let us now look into how the diseases of the kidney happen and how they are classified. The basic classification goes this way. The first one, acute nephritis, sometimes also called as glomerulonephritis. It's a transient inflammatory process of the glomeruli. It is characterized by hematuria, proteinuria, azotemia. Hematuria is presence of blood in urine. Proteinuria is the presence of proteins in urine, and azotemia is elevated levels of blood urea nitrogen and serum creatinine. It is also associated with water and salt retention. The second disease that is very frequently seen is a nephrotic syndrome. It is characterized by large losses of protein in urine. It can be as much as 3 grams per day. The serum albumin levels are low, blood cholesterol levels is elevated, and there is accumulation of water to form frank edema. It can be seen that Nephrotic syndrome differs from acute nephritis because it does not have hematuria or proteinuria. The next category of kidney disease is the acute renal failure and the rapidly progressing renal failure. If renal function declines over a period of days, it is called as acute renal failure or the ARF. And if the period is in weeks, we call it as rapidly progressing renal failure or RPRF. The last category is the chronic kidney disease, very often abbreviated as CKD. It is a progressively and irreversibly destructing disease of the nephrons. Cause can be anything. Renal function declines slowly over a period of time, and it is the GFR or the glomerular filtration rate which determines the degree of renal function. If we have to see how GFR determines the damage to the kidney, stage 1, where the kidney damage is minimal and the GFR is more than 90 ml per minute. The kidney damage with mild decrease in GFR, where the GFR is between 60 to 90. There is a moderate decrease in GFR 30 to 60, the stage 3. In stage 4, there is a severe decrease in GFR that is between 15 to 30. Stage 5, kidney failure, where the GFR is less than 15. Now in stage 5, the patient invariably needs either dialysis or still better kidney transplant. Now let us look specifically into glomerulonephritis, the inflammation of the nephron and the glomerulus. Glomerulonephritis can be either acute or chronic. In acute condition, it develops suddenly, probably after an infection, a streptococcal infection in the throat or on the skin. In chronic cases, it develops after a bout of acute glomerulonephritis. But there are plenty causes which are responsible for glomerulonephritis. There could be infections, there are immune diseases, and it could be even vasculitis. Vasculitis is inflammation in the blood vessels. Now if we look at the infections, post-streptococcal glomerulonephritis, it may take a week or two to develop, and it is rarely associated with a skin infection. Body produces extra antibodies that may eventually settle in the glomeruli, and that is how it causes inflammation. Very often children are more likely to develop than adults, and they also recover quickly as compared to adults. Then there can be even bacterial endocarditis, inflammation of the cardiac membrane. Bacteria can spread to heart and cause infection of the heart valves. Greater risk in case of heart defect, that is damaged or the artificial heart valve. It is associated with glomerular diseases, but the exact link between these two is not yet established. It can also precipitate after a viral infection, and some of the common viral infections are HIV, hepatitis B, hepatitis C, which triggers glomerulonephritis. The other basic broad category are the immune diseases which can cause glomerulonephritis. One is lupus. It is a chronic inflammatory disease and it affects many parts of the body. It affects skin, joints, blood cells, heart, lungs, and definitely kidneys. And the second one is Goodpasture syndrome. It is a rare immunological lung disorder and it mimics pneumonia. It causes bleeding in the lungs and also precipitates glomerulonephritis. The third category in the immune diseases is IgA nephropathy. It is characterized by episodes of blood and urine. This primary glomerular disease results from the deposition of immunoglobulin A, IgA, in the glomeruli. IgA nephropathy can progress for years without any noticeable symptoms. Now, the third category is the vasculitis. One is polyarteritis. This forms vasculitis, affects small and medium blood vessels in many parts of the body, such as heart, intestines, and also kidneys. The second one is Wegener's granulomatosis. This forms vasculitis and affects small, medium blood vessels, again in the lungs, upper airways, and the kidneys. Now these are just some of the pictures to show you how a normal glomerulus can affect the normal functioning, the filtration of the kidneys. The normal functioning, it will not allow larger particles, particularly the RBCs and the cast, to enter the filtrate. But in glomerulonephritis, somewhere the permeability is altered. There is deposition of these antigen antibody complexes, and that is how RBCs, proteins find their way into the filtrate, and that is how glomerulonephritis can be differentiated. Presence of blood and protein in the urine. This is another one. At the cellular level, we see the difference, how the permeability is altered, and there is presence of blood cells inside the filtrate, and that is how we see the presence of blood in urine too. The permeability gets altered drastically, and that is how we see the presence of both proteins and RBCs in the urine. The conditions which are likely to cause scarring of the glomeruli. One could be high blood pressure. It damages kidneys and impair their ability to function normally. Glomerulonephritis can also lead to high blood pressure because it reduces the kidney function, and it may also influence how kidney handles sodium. Kidney has to reabsorb sodium as a normal function, but when the functioning is altered, it can precipitate too much of retention of sodium and water, and that could cause elevation of blood pressure. Then there is diabetic kidney disease, or what is commonly known as the diabetic nephropathy. It can affect anyone with diabetes. Usually it takes years to develop, and if a diabetic patient is able to take care of his diet, drugs, exercise and maintain the blood glucose levels, definitely diabetic nephropathy can be postponed for a long period of time. Then there is a focal segmental glomerulosclerosis. It is characterized by scattered scarring of some of the glomeruli, and this condition may result from another disease or many a times occurs for no reason at all. Now, there are certain signs and symptoms which can alert an individual. Most importantly is the puffiness of face early morning because of water retention. Similarly, there can be swelling of the ankles or the face, what is typically known as edema. There can be blood in urine, hematuria. There can be protein in the urine, which is proteinuria, and urination is less than normal. And because there is fluid retention in the body, particularly again in the lungs, an individual can feel shortness of breath, and he can even have persistent cough. Blood pressure can increase. Most importantly, there is frequent nighttime urination, and the urine is bubbly or foamy. This is because of the presence of proteins in the urine. There are also several complications which can be associated with glomerulonephritis. The first one is acute kidney failure. There is a loss of function in the filtering part of the nephron, and these cause accumulation of the waste products in the body. Under such circumstances, the patient might require emergency dialysis. CKD, the chronic kidney disease, there the kidneys gradually lose their filtering ability. If it deteriorates to less than 10% of the normal capacity, then it is called the end-stage kidney disease. In these conditions, patient requires dialysis or even a kidney transplant to sustain life. High blood pressure. High blood pressure is the damage to kidneys and the resulting buildup of waste in the bloodstream, and this causes rise in the blood pressure. Nephrotic syndrome, there is too much of protein in the urine, and this can result in too little protein in the body, as can be seen by the serum albumin levels. It can also be associated with high blood cholesterol. There can be edema of the eyelids too, because there is too much of water that is getting retained in the body, along with the edema of the feet and the abdomen. But it is very important to have the correct diagnosis done to find out whether it is glomerulonephritis, nephrotic syndrome, ARF or CKD. Some of the common diagnostic tests are the urine test. It is very important because it is a simple test and it can tell us whether it contains RBCs, and because this will be an indicator for the possible damage to the glomeruli. Sometimes the urine can also show the presence of WBCs, the white blood cells. It is a common indicator for any infection or inflammation. There can be even increased protein, and that is again an indicator of nephron damage. Other indicators can be increased or the elevated levels of creatinine or urea, because they suggest damage to kidney or there is an alteration in the functioning of kidneys. Apart from urine test, again blood tests can be done. They measure the level of waste products. Most important are creatinine and the blood urea nitrogen, what is known as BUN, B-U-N, written as capitals. These are very important tests to assess how far the body is able to throw out the nitrogenous waste products. Then imaging tests can also be done. The kidney X-ray, an ultrasound or the sonography as it is popularly known, or a CT, the computerized tomography. Even kidney biopsy can be done. This is a procedure which involves a special needle to extract a very small piece of kidney tissue for microscopic examination to determine the exact cause of inflammation. A kidney biopsy is almost always necessary to confirm the diagnosis of glomerulonephritis. Then if we look into the treatment of glomerulonephritis, first thing, it depends upon whether the disease is acute or chronic. Then it also need to know what is the underlying cause for the diseases. For example, if it's a diabetic, the diabetes has to be controlled and the line of treatment will be different. Then the type and severity of the signs and symptoms. Some cases of acute glomerulonephritis, especially those that follow a streptococcal infection, tend to improve on their own and rarely require any specific treatment, because it is seen that after a streptococcal infection, it takes about 10 to 15 days for the glomerulonephritis to precipitate. Whatever may be the cause of glomerulonephritis, the goal of treatment is to protect kidneys from further damage and the fast recovery of the patient. Most important here is to treat the high blood pressure. Keeping the blood pressure under control is key to protecting kidneys. To control high blood pressure and slow down the decline in kidney function, many a times doctor prescribe one of the following medications. Most important is diuretics. Diuretics do the job of increasing the amount of urine so that the water is lost from the body, and that is how the edema comes down, and as a sequel to that, even the blood pressure comes down. There can be angiotensin converting enzyme ACE inhibitors and the angiotensin II receptor blockers. All these help in bringing down the blood pressure of the patient. Now let us look into the treatment for the underlying cause. If there is an underlying cause for kidney inflammation, drugs are prescribed to treat that cause, in addition to the treatment for hypertension. We repeat again and again, it is the control of hypertension which is very important to take care of the health of the kidneys. Streptococcus or other bacterial infections, very often the treatment focuses on easing the signs and symptoms along with appropriate antibiotic. For lupus or vasculitis, doctors prescribe corticosteroids and the immune suppressing drugs to control inflammation, and this inflammation again has to be controlled right till the level of glomerulus so that it does its function properly. In case of immunoglobulin A nephropathy, both fish oil supplements and certain immune suppressing drugs are being given to treat successfully. However, till date, researchers are not very sure how exactly fish oil supplements help for IgA nephropathy. In Goodpasture syndrome, plasmapheresis is used for the treatment. Plasmapheresis is a mechanical process which removes antibodies from the blood by taking some of the plasma out and replacing it with other donated plasma. Now The next important aspect or the most important module of glomerulonephritis would be the dietary management. In acute, uncomplicated diseases or where children face this problem after any post-streptococcal glomerulonephritis, diet modifications are by and large not necessary. Bed rest and antibiotics are the main treatment. But in case the disease progresses, definitely dietary management becomes very, very important. First, let us look into energy. Generally, normal energy intake is what recommended as per the recommended dietary allowances of the ICMR. Generally, carbohydrate and fat intake is not altered unless it is associated with diabetes, because in a diabetic patient, the carbohydrate intake, particularly the simple sugars, have to be controlled. But yes, carbohydrates will play a major role in the treatment of kidney disease because they give energy, but carbohydrate rich foods are very often low in proteins. But what is most important is to look into the intake of proteins, salt and fluid, because these are the three major components which need to be monitored in any of the kidney diseases. Now, first let us look into the protein intake, and that has to be regulated. Generally, it is suggested that a patient can be given 20 to 40 grams of proteins. Of course, care has to be taken that a maximum of 40 grams of protein only can be given, because we do not want to have any stress on the kidneys. Protein rich foods implies excess of urea, creatinine. Animal foods, purines and pyrimidines. But at the same time, in children, it is very important for us to give proteins because the growth and development cannot be stopped. So generally it is recommended that we give proteins of high biological value. Now, proteins of high biological value are the animal foods. You can talk in terms of egg, poultry, milk and milk products, but then it also a matter of concern because foods with high biological value also are rich in sodium. So we have to use very, very judiciously these animal foods in the diet. Of course, rice is preferred when we look into the cereals because rice contains relatively low amounts of proteins, but the quality of proteins is far superior in rice as compared to other cereals. Of course, sago is a big boon as far as kidney disorders are concerned because they are very, very rich in energy and they hardly contribute to the protein intake. The second most important nutrient is sodium. Sodium by way of salt. Salt is sodium chloride, and this has to be restricted in the diet because it helps in improving the blood pressure. And this has to be limited because along with salt there is going to be retention of fluids. Generally, the sodium intake that is recommended is 500 to 1000 milligrams per day. When you convert it, it is a maximum of 2.5 grams of salt. Of course, the salt intake or the sodium intake can be improved when condition improves. But if edema persists, sodium restriction has to be continued. Now, food with high salt intake can worsen the blood pressure and also the edema or the swelling. So, we have to avoid adding salts to foods. No processed foods and canned foods or salted snacks because they contain sodium, they might contain monosodium glutamate. Then our traditional Indian foods like papads, chutneys and pickles also contain lot of salt, and thereby we are giving too much of sodium to the patient. Bakery products contain baking powder, baking soda, and again it is a sodium salt. Then there are foods which contain monosodium glutamate or MSG, popularly known as Ajinomoto. Now this is also present or very widely used in Chinese foods, and that has to be restricted for a kidney patient. And many of the processed foods also contain MSG to enhance flavor, and these have to be restricted in a kidney patient. Now here we are particularly discussing about glomerulonephritis. But then when sodium is retained in the body, potassium intake has to be monitored. We cannot afford to have too much of potassium going into the body, and that is the reason why potassium has to be restricted, because hyperkalemia or the elevated levels of potassium can cause dangerous heart rhythms. Some of the common foods that we are familiar with, citrus fruits, nuts, roots and tubers, chocolates are rich sources of potassium and which need to be avoided by a patient with glomerulonephritis. Now the third major component here is the fluid intake. It has to be restricted. Generally, the recommended amount of fluid is 500 ml plus whatever is the total amount of water lost from the body as urine. So that is all the fluid that is suggested for a patient with glomerulonephritis. And when we talk about the 500 ml that is permitted, this allowance takes into account the water that the patient takes with drugs, in beverages like tea, coffee, buttermilk, and also the liquid foods that he can consume like soups, thin dals. And that is the reason why very often diuretics are prescribed, because they help the kidneys to eliminate unnecessary water and salt. Of course, there is a major concern over here, giving coconut water. It is a very common custom that we give coconut water to a patient irrespective of the disease. But in kidney disorders, we have to be very particular not to give coconut water, because not only it contributes to the fluid intake, but it is also a rich source of sodium and potassium. Now, because the kidney function is altered, erythropoietin secretion can be altered, and that is the reason why the RBC maturation in the bone marrow can be altered. As a result, anemia can precipitate. In such cases, it has to be treated. Very often, it is simple to give iron supplements and then slowly switch over to foods which are rich in iron. Again, when the kidney function gets altered, the formation of 1,25-dihydroxycholecalciferol gets altered. As a result, calcium metabolism can get altered, and that is the reason why calcium recommendation is about 1000 milligrams or 1 gram per day, because the tubular reabsorption can also be affected in glomerulonephritis. Now, patients with glomerulonephritis show decreased immunity, and for that it is very important for the patients to take enough vitamins to strengthen the immune system. And some of the common vitamins that are recommended are vitamin A and vitamin C, because they help in improving the immune power of a patient. Very often then it has been observed that the acute form goes away by itself. Sometimes temporary treatment with an artificial kidney machine or the dialysis helps to remove extra fluid and control high blood pressure, and it might be recommended if there is progression into kidney failure. Antibiotics per se are not generally used for acute glomerulonephritis, but they are important to treat other forms of diseases related to bacterial infections. Of course, many a times doctors might prefer plasmapheresis. It is a special blood filtering process to remove harmful proteins from the body. Plasma is removed and a fresh plasma is again infused. So, if we just need to look into what exactly glomerulonephritis is, it is the inflammation of the glomerulus, which very often follows streptococcal infection, and it is more common in children than adults, and the recovery also in children is faster, better than in adults. It can also be due to immune diseases or vasculitis. Hematuria, proteinuria, and elevated blood pressure are typically associated with glomerulonephritis. Treatment calls for treating the underlying disease. Most importantly, treat the elevated blood pressure. The most important thing that needs to be restricted is protein, salt, and the fluid intake. And the goal of the treatment is to restore health and protect the kidneys from further damage. Thank you.